COVID pandemic affected us when we were least expecting it. So, doctor, what is the role of Ayush systems in the management of COVID and its symptoms, and what was your experience?
Yes, actually, while talking about COVID, some memories are there because it was a situation in which we were not adapted to anything because it was a huge situation, terrible situation, lot of things were happening. In that situation, we had some sort of different approaches, different managements, different protocols, everything was there. But in my experience, what I did in our hospital, what we did, that I will explain or I will share with you. Because in that situation, we were forced to produce some sort of specific medicines, which has a possibility to work in the COVID situations. We are analyzing the pathophysiology or pathology because it was not known at that time. With the available pathophysiology, we had some sort of formulations and we tried to treat the COVID patient. We made some situations like isolation wards, some sort of changing areas like POP wearing areas, POP clearing areas, waste zones, so a lot of things we made because all of a sudden we were forced to do like that. And we made some around 50 to 60 bedded hospital setup, separate, in addition to the existing hospital, separate setup we made in our college hospital. And we had some sort of special postings for our interns, our nursing staff, because parallelly there was other normal hospital was running, in par with the COVID hospital was also running. And we prepared some special medicine for that, up to in our knowledge. In that attempt, what happened finally means we had opportunity to treat 650 patients affected with COVID, tested, confirmed COVID case. In that COVID case, out of 650, 649 is still alive. Only one patient, we were not able to save that patient because he was already having kidney failure issues. So in that situation, COVID will very fastly affect the systems and we cannot save the patient. He was under severe condition and he passed away. All the other patients we got back with there is no serious problems. That is a finding which I can share with you because while attempting the COVID patient, over the phone we were attempted. By admitted managed we attempted. A lot of things happened. Over the phone, while talking with the COVID patient, his name is actually Rajesh. But patient is not able to say even Rajesh. Ra is coming, next word is not coming because that much breathing problem was there. So identified the issue and tried with some medicines. With the next day, we will be able to trace the change because we will be able to say little more words. Likewise, we got confidence and we step into the issues gradually. And in the course of treatment of COVID, identified some other deep lung issues. With the CT evaluation, we had a CT evaluation for some COVID patients. So exposure area, damage area was identified, and then Pravala Pasmam, some sort of medicines in Ayurveda and Siddha, Pravala Pasmam medicines identified. That medicine worked very wonderfully because the residual damage by COVID was rectified with such sort of medicines. And for COVID-induced pneumonia, treated well with the medicines. So this is some experience with COVID in the last few years back.
Okay. Doctor, you have done many researches on COVID and you have already published so many papers on it. What are your views?
Yeah, definitely. At the time of COVID, suddenly Government of India give notice to every system of medicine what you can do because that's that time no immunization is not there, vaccination is not there.
We don't know about it.
Yes, that's why. So the second option they give to other Ayush system. So in Siddha, we found some of the good medicines. We find out what COVID means in Siddha. Okay, we find out what Kabasura is the actual symptoms which we compared to the COVID. The same symptoms is mentioned in Kabasura. So in Kabasura, we found a lot of the same sort of symptoms and extra other symptoms also mentioned in Kabasura. That in the second stage, second phase, that symptoms is also added to that, like loss of taste and other thing. And in that kabasura we found kabasura kudanir is there, is wonderful medicine for this kabasura. Then we prepared the kabasuram and kept it in that time I worked in Safdarjung hospital, AIMS and Safdarjung, so main center for COVID in Delhi. Under Ministry of Ayush, CCRS, I worked there. So we kept that kabasura kudanir in the side of our clinic. Every day lot of doctors and other the staffs from the Safdarjung and AIMS, they will come there and they will take this kabasuram and they go for their COVID duty only. With that we found that most of the people who are taking this medicine are not affecting much symptoms or other thing, even though they are working in the red zone. Okay. And then we proposed to government also this is working, and they Ministry of Ayush take a lot of good decision to conduct the clinical trials and other thing, and we started one clinical trial in Government Institute of Medical Science, Greater Noida, and they posted me there, and we conducted different clinical trials on COVID with Kabasura Kudanir and Nilavembu Kudanir. Both are antiviral studies. The parallel time we conducted some preclinical studies in ICGB, International Center for Genetic Engineering and Biotechnology. It's a UN institute. There also they found a good result in COVID antiviral thing. Then same time we done the clinical trial. Whoever took this medicine, they are all alive, and their symptoms reduce within a few days. Within I think we can say 5 days is the average days. The symptoms reduce drastically. We took in all moderate and medium the cases for this thing, and because severe is that directly they will admit to the ICU only. But moderate symptom cases, they are not changing to the severe. They are still in the moderate and reducing their symptoms within 5 days, and they are getting admit within a week. That happen in that crucial time. So government also initiated a lot of distribution of this Kabasura Kudanir in different part of India, and some of good publication also came in our good journal like BMC trials and everything. And I worked in inside the COVID ward only. I didn't get any positive because I regularly took Kabasura Kudanir, and also in the night I took Balasarvangam. That is immunity booster medicine for children, but it's very good for adults also. But we only increase the dosage, and we distributed to all volunteers there and other doctors who worked in COVID area, and even for the CRPF and other soldier part, we done a lot of camp for that.
In addition to that, as doctors worked on the Delhi, I had an opportunity to work in a village in our college, Santhigiri. So what was the situation means everybody was worried. So we planned some medicines, to prepare some medicines and to give to the staff first. But there was no idea what will happen, no idea. But we prepared some medicines. One special Kashaya Yoga was prepared, and that Kashaya Yoga was distributed to the staff over there. Initially, they were not willing to take the medicine because we had already more than 350 staff members. So in that, 10 people were taking, and gradually with force we made some necessary instructions, and gradually we spread that across all the staff. So what is observed means all the staff is not getting affected with the COVID. So gradually it spread to their family members. Altogether around 500 to 600 people were taking the Kashaya Yoga. In that, only 1% was affected with the COVID. That given me the confidence to interfere into the society. From there developed the medication protocols, and we made a separate setup to COVID hospital and admitted to treatment.
And some other cases from our other hospital, when they call for some severe lung congestion and other thing, normally I suggested for Chandamarada Chenduram and other Brahmananda Bhairavam and other tablets and Chenduram for them. They are also have lot of, I think some publication also came on that. They have a very good result regarding very fast recovery from the symptoms and other congestion.
COVID-induced fever, actually we prepared Mrityunjaya Rasa on classical yoga. It is the first time in my life I am preparing Mrityunjaya Rasa. Actually, in the classical text, there is a description that within hour, temperature will be under control. That I have observed in that particular situation. With the COVID fever, within hour, it will be under control. So patient will call back, and they will tell doctor, yes, fever is reduced.
And we are talking about the pandemic, and in Siddha system, the classification of fevers are 64. 64 types of fevers are there, and in that 12 are mainly due to some external factors like viruses or other things. In this 64, very definite symptoms is mentioned, very proper medication and line of treatment is mentioned in our system. So that we want to do more research on that, and do not wait for till another pandemic come. Before that, we can find some research, or government want to initiate, or our system want to initiate to do some more research on such.
The pandemic proved how useful and effective Ayush systems are in dealing with these cases. And one more disclaimer I have: please do not fall for fake news and fake claims.